Today I will be talking on immune-mediated oral ulcers, and actually oral lesions may be self-limiting and may undergo remission spontaneously. And among the immune-mediated oral ulcers, the most important are hypersensitive reaction or ulcers due to hypersensitive reaction, ulcers due to Pemphigus vulgaris, or due to Lichen planus, or Erythema multiforme, or ulcers due to systemic lupus erythematosus, or in case of Scleroderma, or ulcers associated with Behcet syndrome. In hypersensitive reaction, usually the clinical presentation may be mucosal ulcers or blisters. In case of Pemphigus vulgaris, Pemphigus, it is an autoimmune disorder, and as you know that keratinocytes are connected together by cement. Some individuals may produce or upregulate antibodies against this cement, and this may lead to abrasions or superficial ulcers. And usually these ulcers are located in, ulcers due to Pemphigus vulgaris are located in soft palate, buccal mucosa, ventral tongue, gigiva, and lower lip. Okay? And now we are going to talk or discuss ulcers, oral ulcers due to Lichen planus. Lichen planus, it is an autoimmune disorder. It usually affects middle-aged females, and it is believed that it is T-cell disorder. So ulcers due to Lichen planus is painful ulcer and appears like white keratotic, and the lesion in Lichen planus appears like white keratotic lines with an erythematosus border. So now we are going to talk about ulcers in Erythema multiforme. Erythema multiforme, actually it is hypersensitivity to infection. For example, hypersensitivity to herpes simplex virus and fungal infection. And oral lesion appears as painful, bloody, crusting ulcers on lips. In case of SLE or systemic lupus erythematosus, and as you know, SLE is an autoimmune. It is hypersensitive reaction type 3, and it is immune complex mediated. Usually the oral ulcer is painless. So ulcers in the mouth without pain. So we suspect in this case SLE. Also, discoid lupus erythematosus, discoid or DLE. It means it is not systemic like systemic lupus. It is localized lupus. Also, this may be associated with labial mucosal ulcer. Also, Scleroderma may be associated with oral ulcer and xerostomia. So now we are going to discuss ulcers due to Behcet disease or Behcet syndrome. Behcet disease or syndrome, it is an autoimmune disorder, and it is characterized by a triad: oral abscess ulcer, genital tract ulcer, and ocular disorder or diminution of vision. Thank you very much, Professor Ahmed Poulad.